The cardiovascular health for adults in the U.S. is less than impressive, according to a new report. Dr. Serrani joins us live once again to discuss this. Dr. Serrani, it's so great to see you again. This report took into account several things. That's race, sex, the diet, and then the socioeconomic class. And it also looked at children as well. What was your take from this?
Good morning, John Thomas. Glad to be here. I think the cardiovascular disease is a major global challenge worldwide. We know that almost 18 million people die in the world of cardiovascular disease. In US, every 36 seconds, one person is dying because of cardiovascular disease, and it cost us more than $300 billion. So by the time we are finished talking, 10 people probably would have died because of cardiovascular disease. That's very depressing data. But on the other hand, if you look at it, they look at 8 parameters or 8 metrics, try to give some scores and see where we stand. For the children, they use 3, like your diet, physical activity, and BMI. They did poorly. They scored 65. Why is that so? Well, we all know that we sit in front of computer, we don't exercise, we don't go out. That can lead to that. The other factors, I think, in the adult, they expanded another 5 factors, just like you're talking about the tobacco use and blood sugar, because obviously in children, you don't see those issues. Those 5 factors turns out to be really prominent, and you scored really poor. The other thing, sleep. I think that's very underestimated, but when you have a poor sleep, it affects your blood pressure, it affects your sympathetic tone, it increases the risk of heart disease and stroke, and vice versa. And then you again have a blood pressure and a lipid. So in other words, if you take those 8 factors, again, it boils down to your diet, physical activity, BMI, sleep, and again, tobacco use. So those are the things which are controllable factors. And this is one of the very good things. Now we can put a number on our scores. So and pretty soon there would be apps there. So you can go in and you can feed your information and it will tell you what your score is. And I think people can correlate more with that number that, oh, well, if I'm 65, just like BMI, if you're 35, you want to get down to 30 or 30 to 25, 26. So I think those numbers are going to help the public, and they can serve as their own report card and set their own goals.
Okay, Dr. Serrani, as always, we appreciate your insight. A lot to take in there. We'll have it on our website, that interview, at KTVI.com after the show. Also, if you have a question in the meantime, you can text us at 361-855-6397. No topic is too taboo.